it's funny because, well, not funny, it's sad actually that for a long time, a lot of arguments were made that pediatric LVO stroke had good outcomes. And people were able to get away with this because there was the occasional patient who would do well, who had very good collaterals, and therefore they would be held up at every conference or at every case meeting and said, well, look, this kid did all right, so we don't need to treat these patients so aggressively. But we published last year an article looking actually at the natural history and showed that the natural history is quite poor. More than 50% of children in the long term had medium to severe disability and or death. And as a result of that, I think we quite definitively demonstrated that the natural history of the disease is poor. I think the former arguments were that children do better than adults, and I think that's true if you treat them the same. If you treated adults conservatively, they do badly. And if you treat children conservatively, they do slightly better than those adults. But now the adults get thrombectomy, so the argument doesn't hold anymore. And so I think we're past the point where we can say children do better and we should just leave them alone and see what happens, because we leave a whole lot of children to long-term disability, which affects them, their whole family, and it affects them for the remainder of their life.